Hello and welcome to the Boy, Girl, Mom, and Dad podcast. Today it's just the mom. It's not a solo episode, but it is my first time doing it without Nick, and I have a guest here today. This is episode 45. Relax, it's just your pelvic floor.
Boy, girl, mom and dad here for the good times and the bad. From gender norms and stereotypes to making sure that the butts are wet. Boy, girl, mom and dad want grown-up time, you're going mad. It's a trip, but we'll guide you through with tips and tricks for boys and girls too.
Hi, and welcome Dr. Andrea Levkowitz. I'm so glad you're here today. She is a pelvic floor specialist and a physical therapist at Origin and a twin mom, which we love. Welcome.
Thank you so much for having me.
Yeah. So this is episode 3 of our Dear Mama series that we did for the month of May. And I just wanted to focus on things for moms because I feel like a lot of what we talk about does involve like parenting, but I wanted to talk specifically to the moms because a lot of it's for our kids. And so this is about our pelvic floor, which I don't think is talked about enough. I'm so excited to talk about it today. But before we get into it, we have a Tiff every single episode that Nick and I usually go into. Sometimes we agree, sometimes we disagree. And this is something that I do that I know that I shouldn't be doing, but I'm just going to talk to a specialist in it. So when you're in public and you go to the bathroom, do you sit on the toilet seat or do you squat? And I say that because I squat and I know I shouldn't be doing that for my pelvic floor, but how bad is that for me, Dr. Andrea?
I 1000% sit every single time. Sitting on the toilet is so important so that we can be using proper mechanics that you may not be symptomatic at the time, but you will thank me in 20 years from now when you aren't continuing to come see me on a regular basis.
Okay. And also I had never thought about it before, but I've seen like don't blow your nose while you're going to the bathroom too. Is that something you shouldn't be doing because of things that are connected, or is that just a myth?
Yes, that is something that you should not be doing. When we sit down to go to the bathroom, our pelvic floor muscles are in a state of more relaxation or lengthening. And so if we are blowing our nose, that adds more downward pressure to the system when it's not in a position where it can support us properly.
Okay. And now, since we're talking about it, are there any like pooping tips that you have that you can like maybe the top one you give to people if they're looking to like have better bowel movements like and treating their pelvic floor nicely?
Yes, I love talking about pooping, so I can give you several tips.
Yay!
First thing, one people should know is that not everyone is an everyday pooper, so there's no need to force yourself to poop every day. Really, 3 times a day to 3 times a week is all considered normal. Another thing is not straining to empty your bowels or your bladder, so we don't need to be in a rush to empty our bowels, but also we don't need to sit there for 30 minutes either.
Yeah. I actually saw, and you can say yes, that's true or not, but where if you are sitting down for more than 5 minutes, you're should get up and like then come back if you still feel like you still have more because it creates like is it like a suction on like I don't know, does that ring a bell at all? Is it if you shouldn't sit longer than 5 minutes?
Yeah, so typically, once we feel an urge to move our bowels, it's best to, finish what you're doing and get yourself to the bathroom. Sometimes people don't love to go poop in public restrooms because they may not love to sit on the toilet. And since now we all know that it's not optimal to be hovering over the toilet, but when we routinely suppress the urge to go to the bathroom, it takes more effort from our body when we do decide to finally sit down and go when there isn't an urge. So sometimes that results in us having to sit there, having to push a little bit harder. So ideally, you get the urge, you go to the bathroom. If you're there and it's been longer than 5-ish minutes, get up, walk around, see if that urge comes back, sit down, try and go again, but just staying there because oftentimes we're pushing and we may not realize it, and that can affect our support, can lead to hemorrhoids, not an ideal situation.
Yeah, and I feel like as moms, oftentimes we're like, like I can't poop right now. I have to do something like regarding the kids, and so I think it's so important that we talk about it. Do you have a squatty potty? Are you pro squatty potty? We're a squatty potty household.
Yes, I am pro squatty potty, but I am not 1,000% everyone needs to have a squatty potty. You really
Yeah.
have to find what works for you. Some people do great with squatty potties, others don't feel like it makes a huge difference for them. So really, kind of looking at the whole person, realizing that if this doesn't work for you, or maybe you have some hip pain or back pain and you're uncomfortable in that position, not optimal for you. I always have patients use a step stool or one of those smaller garbage cans just to try and see if the position works first. Most moms, if they don't have a step stool, eventually they will have a step stool. And so try that out first before spending more money. But yes, I am a fan of squatty potties.
And yeah, so you're saying what I sometimes do, I'm exposing myself. But if I'm at a place that doesn't have a squatty potty, like a hotel room or, somewhere else, and there's like a little trash can, I will scoot it over and use it as my like
Yes,
step stool. So it's a very good point.
brilliant.
You don't have to
Yes,
buy like the name brand. I've seen people like, not seen people because I'm not like watching people do this, but I've heard of people, like stacking books to a certain level and
yes.
see what works for you. But yes, very pro squatty potty. I remember when they were on Shark Tank, and I've had one ever since. So very pro.
Yes, and
Very
very important. I know we're talking about moms, but important for our kiddos too,
yes.
is that you try pooping when your feet aren't flat on the floor. So when you're potty training your kiddos, make sure that their feet are on something. It's going to help them be able to empty their bladders and bowels better.
Yes, and we have them in all of our toilets, and so they will oftentimes try to use the step stool or the squatty potty to help them go to the bathroom, and which I'm very pro because again, pooping I feel like is the last part of potty training. We did potty training in January. We have a whole episode on it that I'll link in the show notes for you if y'all haven't listened to that one yet. But something that one of ours took to pooping more easily. It was hard for both of them in the beginning, but the other one was having a little bit of a harder time because it's honestly kind of scary pooping in the potty when you're a little kid, whether it's like the water that drops or whatever. But also we've had one of ours like hold it in more. And so we had to have on some like natural, we had like a Cinna supplement that was for kids that was helpful and things like that, just because, and we introduced a probiotic. It's that we use a Llama Naturals multivitamin, and then we just added in their probiotic as well, which I do have a discount code, I think. So I'll put that in the show notes for you. But very, very pro teaching your kids the right way to poop. And we have talked with them about like straining and pushing, that we don't have to do that.
Exactly. You have to start them with these proper mechanics early and keeping the lines of communication open. Because so often in my field, I see patients that are, closer to their menopausal years, and they've really never known the proper mechanics to empty their bladder and bowels. So,
Yeah.
teaching your kids early what's normal, and just because they can do something doesn't mean that they should do it that way, and just keeping those lines of communication open.
Yeah, and we're gonna get off of this topic of poop in a minute, but I'm healing from ulcerative colitis, and so I have like a bowel disease, and so like I know some people have like the problem where it's like too much, not to go into like too much detail, but for me, like it was very hard for me to go to the bathroom. And so like I would often start keeping track of when I would poop. So I'd be able to tell my doctor, like, this is how but far in between. And like now I'm happy to say that I have a very healthy like pooping schedule, if you will. And it's like,
Yes.
but also like as women, like I actually don't know if this is the same for men, but as women specifically, I've read that if we don't go regularly, that like the estrogen gets reabsorbed into our bodies. And so that's important for us too.
Yes, I mean, in so much of what we're learning about the gut, and how just a healthy gut environment is so important, no matter what gender, age. So I think, and taking a proactive role with that, makes it much easier to manage long term.
Yeah. Something that really changed for me is like I was on probiotics, but not all probiotics are created equal. And then I
Sure.
got off of it because my GI doctor was like, well, I think there's not one out there that would really be helpful for you at this time. And so I wasn't on one, but then like my OB said, you should try seed. And I know people either love or hate seed probiotic, but I've been on it for 4 months, and that I think has truly, truly helped me turn things around too. So anyway,
It's great.
let's let's kind of get into, this is all pelvic floor related, but let's get it a little bit more specific. So I want to know what your story is, Dr. Andrea, and like how did you get into this niche of physical therapy, which I'm so glad exists, by the way.
Yes. Like so many of my counterparts, I went into physical therapy school not even knowing that this area of physical therapy existed. We had very little in my schooling about pelvic floor and pelvic floor physical therapy, basically a couple lectures, and piqued my interest. I initially went into physical therapy school thinking I would do outpatient orthopedics. I was an athlete all my life. That's just kind of the route that I saw myself. And then got into school and realized, I think this is the right profession for me, but I'm not sure outpatient orthopedics is where you'll find me. So ended up starting my career in acute care, working with patients that were in the hospital, anywhere from ICU to post-op knee replacement surgery, everything in between, and started to see how prevalent a lot of symptoms of pelvic floor dysfunction are, especially with urge incontinence, stress urinary incontinence. People are in the hospital, they aren't as mobile as they're accustomed to, and just the stress of getting to the bathroom or not being able to go to the bathroom. And then that, impacts your ability to go home from the hospital. So again, it just kind of kept in my mind. And then I actually developed some symptoms of pelvic floor dysfunction prior to having my own kiddos. So all of those combined really pushed me to say, okay, this is something, and we need to have more people treating this patient population. And so that's when I started to kind of change the course of my continuing education and dove headfirst into the world of pelvic floor. And here I am now, going on 9 years later. So it's an amazing area of physical therapy, so needed, really, really growing, and just thrilled that so many people are starting to talk about it.
Yeah, me too. So this may be our listeners' like first time really hearing about pelvic floor. I don't remember I took anatomy and things like that, but I don't remember them saying like, and this is your pelvic floor and this is what it does and why it's important. So can you kind of give us an overview about like what is our pelvic floor and why is it so important?
Yeah, I agree. I think back on when I was in undergrad and even graduate school, I don't know that anyone really said, hey, this is your pelvic floor and this is what it does, or hey, you have muscles here. So I think that that's very common, is that we don't really talk about this area. For women, oftentimes we're just told, hey, do Kegels, and that's kind of the extent of it. We aren't really taught how, assess that we're
Yeah.
doing them correctly. And there's so much more to the pelvic floor than just Kegels. So our pelvic floor is really a group of muscles that sits in the base or floor of our pelvis. They have several roles. One is what we call sphincteric, so it helps with bladder and bowel continence, so it helps us control the urge, but also these muscles help us to evacuate our bowels and empty our bladder. These muscles are crucial for support, so they help us support our pelvic organs. They help in stability, so they are part of our core. So we oftentimes think about our core as our abdominal wall, our back muscles. Now we're talking about our glutes a little bit more, but really the foundation for all of that is our pelvic floor. These muscles also are important in sexual functioning. And then another role is what we call a sump pump. So these muscles help with circulation to pump blood and lymph throughout our body. So really, really crucial muscles that we don't talk nearly enough about.
Yeah, amen. Are your jaw and pelvic floor actually connected? I've seen that like if one is tight and you clench, you probably is the other one's probably tight and clenches too.
Yeah, you're
It's
absolutely
wild.
correct. You are absolutely correct. So that's something that we are often talking to patients about, especially when we find that they maybe have more overactive pelvic floor muscles or they're coming to us for pelvic pain. We'll talk to them about, hey, where do you tend to hold stress? Is it up in your neck and shoulders? Do you clench your jaw? Have you ever had any jaw pain? Do you grind your teeth? And oftentimes there's a common link between jaw pain or tension and pelvic floor tension.
Mm. Why do you think this hasn't been like a well-discussed topic or like even promoted topic until now? Well, I'm gonna let you answer and then I have some thoughts on it too, but do you have any thoughts on why this hasn't really come up until the last like, I don't know, 10 or so years?
Yeah, I think for so long it was kind of taboo. It's just we didn't really talk about bladder, bowel, sexual functioning, and a lot of symptoms of pelvic floor dysfunction, pain with intercourse or urinary incontinence, or pelvic pressure or constipation or different things like that oftentimes we're led to believe are just normal for the season of life that we're in, whether we are postpartum, whether we are perimenopausal, menopausal. So if we're led to believe that these symptoms that we're having are normal, we aren't going to disclose them because no one's asking us. We don't
Yeah.
think that there's anything that we can do about it. And it's not an easy thing for a lot of people to bring up. Not all providers are comfortable talking about these topics. So oftentimes we kind of suffer in silence.
Yeah, and I've heard said time and time again, just because it's common doesn't mean it's normal. And so a lot of women
Yes.
experience this, and so it's common, but it's not normal, and we should get help just to. You already said everything that the pelvic floor is connected to and controls and helps with. So it's just really important that we, understand it. And we're not really taught that. I think that I'm very passionate about like, I think we need a whole I don't know, a whole class growing up like on women's health because they don't really tell you like, all of our cycles like luteal and I mean maybe they go into ovulation a little bit, but I don't remember talking about the follicular phase. And so I feel like it's lacking just because it's harder to study women just because, like even in medicine, they need to have it on like a woman trialing something on each part of their cycle. But something that I think is good because that's a little bit of a sad part of I think of like our medicine, like where we're at, even though we've come so far. But I do think social media has helped a lot to where like people are like, oh wait, that's not normal, or oh, that someone else experiences it too. And so I've seen a lot. Origin specifically, they do a lot to like share and like educate women on their bodies and these muscles that are so important.
I agree. I think social media has been great for people understanding and starting to hear more about the pelvic floor and starting to be able to advocate for themselves. I think a lot of times when we have these symptoms on the outside, we look healthy.
Yeah.
It doesn't look like anything's wrong with us. And so people suffer in silence and just not knowing who to go to, what to say. You may talk to your friends and, either everyone leaks when they run, or they just stop running, or they don't jump with their kids, or everyone seems to be having amazing sex, and you're over here like, sex is so painful, and what's wrong with me? So I think, social media has been great for just kind of breaking down some of those walls and getting people more comfortable with talking and speaking up, saying, hey, this isn't normal and I'm not okay with this. And I want to improve the quality of my life.
Yeah, yeah. So I think that everybody deserves to learn about their pelvic floor, but specifically, let's talk about pregnant women. So I was referred to Origin by my OB, bless her, um, just because I needed it. A twin pregnancy, as you know, is no joke, and so I started it around like the end of my second trimester, beginning of third trimester, just because I have a lot of pain in my hips. But
Mhm.
I'm wondering, would you have suggested, starting at the beginning of my pregnancy? Like, what is a good timeline for someone who's listening who is pregnant or thinking about becoming pregnant? What would you suggest to them for doing physical therapy in their pelvic floor and or surrounding the pregnancy? like timeline
Yeah.
wise?
I mean, I really think it's never too early or too late. There's so much during pregnancy and that season of life where we just aren't given all the information. And this is such a huge change for us, our bodies to go through. And so coming in when you're thinking about conceiving and just learning, because like we said, most people haven't learned about their pelvic floor, and are led to believe that, okay, I just do Kegels and I'm just going to do 100 Kegels every day and be fine. So even just to get an evaluation and start talking about it, because oftentimes we may find symptoms of pelvic floor dysfunction that the patient didn't even identify because it's their normal. And so we may evaluate you, before you actually conceive and say, hey, let's address these things, or in the first trimester and say, okay, let's focus on these couple things. And then if you're doing well, okay, I don't need to see you back for 6 weeks unless something comes up. But if you don't know about pelvic floor physical therapy or aren't able to come in at that time, it's never too late at
Yeah.
all. Whether, you are 36 weeks, whether you are 15 years postpartum, is never too late.
Yeah. So I came in when I was cleared, which was about, I think, like 2 months postpartum, because I
Mhm.
gave birth in October, and then I remember coming into Origin in January, and then I was there until May. So I was not cleared to work out until I was 6 months postpartum, just because of how my diastasis recti, the DRA, was. Which I'm so thankful for, because otherwise I feel like I would just been cleared and been like, okay, go do it, and like I would be over there like trying to do a plank, and there I would be coning or something. That's when your stomach or your muscles, because there's a hole in your I should start at the beginning. Diastasis recti is like when you have a hole in your abdomen. You could probably explain that better. But and so like your stomach will come through and coning. I remember like laying down like maybe a week or so postpartum, and I was like laughing, and it was like the Loch Ness monster was coming out of my stomach, and I was like, okay, I think I have a problem. Just because I was like, I've heard people talk about this, but now I'm experiencing it. So like, I that's when my OB, who couldn't fully diagnose, but it's like, yeah, you have DRA. And then whenever I went to Origin, they're like, yeah, we can obviously officially diagnose you there. And so I don't do crunches anymore. I'm like, nope. If I'm in like a group workout class, like even in yoga, they'll do crunches or things like that, I opt out and do something else. And that's what the moves that I learned from my physical therapist at Origin. And I just don't feel the need to do those anyway. There's so many other things that you can do that will help your core and strengthen you. But yeah.
Yeah, and the world of DRA is coming so far. We used to, just be solely focused on, oh, you have to close the gap, you have to close the gap, you have to close the gap. And I myself, by definition, have DRA as well. But I've learned to build tension through that middle area that you were referring to, which is your linea alba, which is connective tissue. And so it's really that's what's important, to be able to give us some structure and support. And so oftentimes when we measure the width of that gap, it may not come back together to where it was pre-pregnancy, and that's fine, but we can be completely functional. Like I can do a full crunch even though I have DRA. We're learning now, with coning, some coning is actually okay if it's squishy and if we feel that, because it's important to be able to get these tissues stronger. We need to be able to load them. And so it's really just not taking them to their end range where that coning feels really hard. And so it's great to finally see more research going into this area to say, hey, this is a normal change with pregnancy. Our body has to accommodate, especially multiple births. And so we're going to see this separation, but that doesn't mean that we can't do all of these things later on. And we can't be so limited. We need to be able to put our bodies in position where we can safely load and strengthen.
Yeah, and I think that a lot of women experience the DRA, or I had a C-section, and so kind of accompanying that is like the C-section, like pooch. But like you said, there are ways to strengthen it, and it's beyond the aesthetic. I know a lot of
Mm-hmm.
women I speak to are like, because of that, I don't like my abdomen and the way it looks anymore. But there really are so many things you can do to strengthen that's actually amazing for your body, and in result will kind of give you more of the look that you are wanting. But it takes time. Like I like my twins are 2.5, and I feel like I'm just now kind of like coming back, and that's from work that I've done. It's not an overnight thing, and I think that's what also makes it really hard.
Right. Well, and we're moving forward. This whole idea of bouncing back when our bodies have done amazing things. Like we have carried humans, we have, been pregnant, we have delivered. And so, like, let's harness that and we can be better versions going forward instead of, reaching for something that was in the past.
Yeah, definitely. I actually don't know the answer to this. If you start physical therapy early enough and like are consistent with your exercises, are you able to prevent DRA entirely or just make it a little bit better than what it would have been, if anything at all?
So, do you mean starting physical therapy or exercises
Yeah.
early in pregnancy?
Yeah.
Not that we know of at this time, really, what research is showing is that in the later third trimester, 100% of birthing people will have evidence of DRA. There's a lot of factors on why in some it just naturally heals on its own and others it doesn't. Some genetic components, likely a lot of different factors. But even when we say, okay, it's healed, how are we defining that? Are we saying it's healed because there's only one finger breadth separation between those two walls? We have to add in that function. Are we using our abdominal walls, our abdominal muscles correctly? Are we managing pressure correctly? Because our kiddos grow. And so it's one thing to be lifting kiddos that are 10 pounds each, but eventually they're 20 pounds. And so sometimes we may not have symptoms at that time, or some compensatory strategies that we're using aren't causing us any symptoms, but then later on they may cause symptoms because we're loading our system more, and it's just not prepared for that.
Yeah, totally. Speaking of relaxing, one of my favorite ways to relax is to throw on my Lunia pajamas and just, try to relax at least. As a busy mom, I can't always do that, but there's something about putting on their apparel that just makes me say, ah, so good. So they do have their silks, but they also have their organic Pima cottons that they just launched, which I love. And you can get a discount on these with code BGMAD. You can use that on your first order and enjoy the relaxation with a little bit of a discount. This is part of the Dear Mama series. And so if you forgot to get your mom a Mother's Day gift, if someone forgot to get you a Mother's Day gift, get a little something for yourself. Or if you just want to gift one of your friends or mother figures, this will be perfect. So enjoy Lunia with a discount code BGMAD. You kind of already said it, so I know you're going to agree with me, but one of my big things is I'll talk to my friends who have not been pregnant, who have not had kids, and be like, you need to work on your pelvic floor, just because I know they experience the urination frequency to where they have to go often. I think there's other things too where I'm just like, that's a pelvic floor issue and I need you to go work on it because it's connected to so many things. And if you're planning on having kids, it's can possibly get just worse. Like, let's go ahead and work on it together. Do you have clients who aren't there for like pregnancy and they're just there to work on their pelvic floor?
Oh, absolutely. Patients that have stress urinary incontinence, they maybe, are or were a competitive gymnast or dancer or something where, a lot of impact, and they have leakage of urine, or lots of patients with pelvic pain. They have never been pregnant, or, it may just be pain with intercourse. They want to have children in the future, but are unable to tolerate any vaginal penetration. So yes, it's absolutely, like I said before, never too early, never too late. I wish that this was just a part of the well woman exam of like, okay, we start to do all of this preventatively. Why do we have to wait for symptoms to start educating and checking in, to make sure that everything is functioning optimally?
Yeah. And something that I love that I feel like it's not easy to find is, at Origin, they accept insurance. And like my OB wrote me a script and it was covered by my insurance, which I feel like when you're trying to do these things that are more, this isn't new agey by any means, but I feel like it kind of falls under that for some people. It's like, what are you even talking about? Like, physical therapy isn't even a requirement after you have a C-section, a major surgery, like the only one that doesn't have that requirement. But I feel like that's so hard to find. And so I'm so thankful for people like you who, take it upon yourselves to kind of blaze a trail in this field. And I'm super thankful for Origin too.
Yes, accessibility is a huge priority of ours. I could go on a whole soapbox, but we'll save that for another session.
Well,
But yes, it's so important that people have access to this care.
yeah. So I have recommended people like go work on your pelvic floor, find a physical therapist, and then they'll go find one. And unfortunately, I think part of it's like, oh, I was looking for one that, I could go see in person, and or one that my insurance would take, but they're not a specialist. I'm like, no, you have to find a specialist, someone who works in this day in, day out. And specifically, I would go with the woman just because, I mean, that's what we're talking about here. And so I feel like the things that we're going to be discussing, it would be better or easier, more relatable to talk with someone who may experience or understands your experience. And so what would you tell someone to look for when they're looking for someone to work with their pelvic floor? Like what
Yeah,
specifics of a doctor would you look for?
Yeah, I think, if we're talking about physical therapists, I agree with you. I think somebody that specializes in treating patients with pelvic floor disorders, some of it, with any medical provider, finding someone who you have a good rapport with, I think is so important. The clinician can be an expert in that area, but, if you aren't able to develop that therapeutic relationship, I think that can hinder progress. And so I think it's okay if you, find someone, and if it just isn't a good fit for you, to be able to find someone else that maybe, you feel a little bit more comfortable with. With this being such a specialized area, there's not enough of us. So oftentimes people are in areas where they don't have a ton of pelvic floor physical therapists. And if they do, some of them may be cost prohibitive, or they may have long wait lists to get in. So there can be a lot of barriers to care. I think obviously, I'm a fan of in-person pelvic floor physical therapy. I used to work in the clinic. I'm fortunate now to be with a company that has both in-person and virtual. I work on the virtual side, which a lot of people are like, how the heck do you do physical therapy virtually? And how do you do pelvic floor physical therapy virtually? But I'm telling you, it is so effective. And for busy moms like ourselves who often maybe can't get in once a week, or, finding childcare and it's a long drive to the clinic, or, we need a certain time period. It can be so helpful to really put you in a position where you need to be able to feel what these muscles are doing and have that confidence that you can do this outside of the clinic. And if there's something at home that you're struggling with, we can look at it together, whether it's picking up one of your kiddos, whether it is, early on postpartum and sit to stand from the couch, or bending to change a diaper, different things like that. Being in your home environment so we can problem solve it together is really, really helpful.
Yeah, and anything is better than nothing, like doing it for yourself. And I love that Origin has like the virtual option. Is that available in every state in the United States, or
So,
just
so we have virtuals available in 39
okay?
states. We do pelvic coaching in the other states, but yeah, we are across the nation.
Yeah. And like I saved like my workouts and stuff from there, the exercises that my PT gave me. But honestly, it was during a time where, like, I don't know, the first 6 months, I wouldn't say it's like rough, but it's the newborn fog. And so like I
Mhm.
had trouble like even I was like, I don't know if I can do one exercise. I was very overwhelmed. And so I have like a folder on my phone of like all my PT exercises. And then I actually got an online course, and there's something about me doing two of those things, not just like the in person, but like me applying it myself. Like Origin set the base for me to like understand, like, okay, I get this. It just like all kind of clicked, and like I was able to do the routine. I don't know. I know Origin gave me a routine and they have like a great way of like going through it, but it was something about like something else. I was like applying it by myself, which it's kind of like when you get homework in school, like you're learning it from your teacher, but then when you go and do it by yourself, it was just something that clicked for me. So my point is that like, I think there is a beauty of doing it at home in yourself. And also when you're doing it in your home, virtually, you're learning how the changes you need to make like in your home and how to apply them right then versus like, okay, we talked about tightening my core, so whenever I pick up my child, I need to do that. But you can actually like practice that because in person, you're not usually like with your child. So I think there is a beauty to it all.
Yes, it's great to have options. And I think so many people, their goal may be to get back to some group workout environment, but getting the confidence and that foundation of like, okay, I know how to modify. I know what to do. I know what to feel in my body so that I can go participate in that group yoga or group Pilates or something like that. So, like you said, having that foundation, but then being put into an environment or a situation where you have to apply it. Because sometimes then you go back to your PT and say, like, okay, I thought I had this, but I'm feeling this during X. And so then we can start to work on that.
Yeah. And so actually, I just went in this year, January. So a little bit after my twins had turned 2, just for the sheer reason of like, let me go back to my PT. I am more clear mentally now, and I think I can focus a little bit more. Let's see how I'm doing. How am I? I think I'm doing okay, but I just want to like check in and like relearn. And so I was doing well, but then again, she worked with me on my breathing and things like that. Like something so simple as breathing, like it seems so easy, but it's actually very hard. And so we did like the balloon breathing to where you can make sure like you're blowing out and like you're also engaging your core. And it just changes so much. Like I try to do some form of breathing every day. And sometimes, it's just like we're sitting in the car and Nick, my husband, is like, what are you doing? Because I'm not talking. I'm like, I'm working on my breath work. Please leave me alone. But then I also like another thing that like I do daily is like when I pick up my kids, and oftentimes I'm still trying to pick them up at the same time because they want to be picked up at the same time. I am like, engaging my core and lift, and it just like the proper way to squat and but not on the toilet. We're sitting on the toilet. But the proper way to squat, like when I pick up the kids, or like when we're going on a walk specifically just around the neighborhood, or they want one of them to be picked up. Like there's a way that I make my like engage my core and like work with my pelvic floor when I'm doing that is different than before. And it only is helping me like get stronger. Like I felt strong, when I was pregnant and things like that, but I know that I'm just getting stronger, which I love. So those are some things I do. What's one thing someone can do today to help their pelvic floor? Just maybe they don't know where to start, or they kind of do know where to start, but they're feeling overwhelmed like I did. So it's like one thing that they can do today, right now.
Yeah. And I think you nailed it. Breathing and understanding the relationship between your diaphragm and your pelvic floor muscles, and also realizing that your pelvic floor muscles, they're skeletal muscles. They're just like our arm muscles, our leg muscles. So it's not just about squeezing these muscles. We have to be able to squeeze or contract them, but also lengthen them. And so really understanding it's more about that full range of motion versus muscles that are just tight all the time. That's typically what we see, but people don't realize it. And so starting to do some deep breathing where we're breathing into the lower part of our rib cage, into our belly, that helps our pelvic floor muscles lengthen. And then as we exhale, those muscles automatically engage to be able to support us. And I always tell my patients that we lengthen to strengthen. And so realizing that tight pelvic floor muscles or tight muscles anywhere in our body are not strong muscles. Those aren't muscles that are functional. If our muscles are like this all day long, are you going to be able to pick up your kiddos and just scoop them up? Probably not. And so same thing with our pelvic floor muscles. And so really working on breathing down into your lower abdomen, into your pelvis. Oftentimes we breathe really shallow and we don't realize it because we're multitasking and go all the time. So just slowing down and being able to calm your nervous system, reconnect, reset, recalibrate is very helpful so that your pelvic floor muscles are in a position that they can help support you when you go to scoop up those kiddos.
Yeah, and if you're able to go in person somewhere, just because when we're talking about Kegels and like some of us just aren't even doing Kegels correctly, and I was not doing it correctly. So before I went in and I guess a while ago, I thought that I might have some prolapse, which was interesting just because I didn't deliver vaginally. And so my OB like kind of, she can't diagnose, but she was like, yeah, that does feel like it. Like you should go and talk to Origin about it. And then also she was like, do a Kegel for me. And she was, and I did it. And she was like, no, that wasn't a Kegel. But it's not just like exercises on the workout floor at Origin. Like they can actually like, I remember when I first came in, they looked at my scar and they taught me how to massage it because again, that's another thing that they don't really tell us to do. My OB did tell me to do it, but she's a special angel human being. And she did tell me like to massage my scar, but that is like so important. And my point is that they can like check and like there's a lot of things that they can do in a room, like not publicly and like the little workout floor that if you're able to go in, just know that that is an option.
Yes, absolutely. It can be so helpful just for that reassurance, to make sure that you are engaging the right muscles in the right way, and not only for being able to engage them and contract, but also fully lengthen them, because that's important as well.
So you gave us one thing to start doing now to help our pelvic floor. What's one thing that we can stop doing today to help our pelvic floor besides just squatting on the toilet?
Yes, so no need to hover over the toilet. So we're going to be sitting on the toilet. Also, no need to strain. And so if we're straining to empty our bladder and our bowels, or straining to pick up something heavy, holding our breath to stabilize, that's a big one. And so if next time you go to pick up your kiddos, or you pick up your 10 bags of groceries and you realize that you're just holding your breath and picking everything up, being able to learn, again, focusing on that coordination so that we are supporting our pelvic floor, exhaling and managing that pressure as we're going to lift heavy things.
Yeah, and that actually will help you in your workouts too, because we're not supposed to be holding our breath when we're doing like workout classes as well, or working out in general. So I think, again, the pelvic floor affects everything. And by working on just something as simple as a breath, or working on something as simple as not holding our breath, it can have like a huge, huge effect in our lives in such a positive way.
Yeah. And you can integrate this into everything that you're doing. You don't have to do Kegels every day for the rest of your life. You can incorporate this when you're doing squats, lunges, bicep curls. It can just become part of your regular exercise routine.
And like Dr. Andrea said, like if maybe you're not at a place where you're like, I can't work out, I don't have time to do that, you're not at a space. First of all, I would encourage you to make the space to do that, because I was similar to that. And like I didn't start working out like with a plan, a routine rather, until my twins were over a year old. Remember that I didn't get cleared until they were 6 months old, but I'd already kind of gotten into a routine of not doing it. And the working out like helps me mentally. In our episode last week, we actually talked about that. And I talked about like things postpartum and things that I would, change or do differently. And I wish I would have started like working out sooner, and not for the physical aspect, but just for like the mental and the breathing. But if you're not there yet, if you're overwhelmed, you don't have to work out to be breathing. She said you can picking up your child, like don't hold your breath, engage your core. All these things are doable without even picking up a weight.
Yeah, and a lot of things that we do during virtual visits is figuring out, okay, how can we get some of this integrated into your daily routine? So your kids are doing tummy time, or they're doing something, and how can we have you practicing how you're squatting or hinging or doing different things? One of your kids is doing tummy time laying on your tummy and you're on your back and you're doing some of your exercises, so you don't miss out on that time to be with your kids. But you're also able to start taking care of you and seeing, okay, how can I incorporate this? How can I think about this without finding those extra 30 minutes by yourself? Because that just often isn't there and is overwhelming to think about.
Yep, 100%. So I like to keep it not vague, but not as specific, but because you are a twin mom, I want to ask you,
Mhm.
is there anything specifically that or even just like moms of multiple, so triplets, quadruplets, all you moms, superheroes out there, all moms are superheroes. I was just recognizing the hardness that comes with having multiple children of the same age. But it's also beautiful, and I love you, Cypress and Olive. But is there anything that our moms of multiple should be doing differently or in addition to, regarding pelvic floor and maybe physical therapy?
No, I think, you said it beautifully before, is just giving your body the grace and knowing what it went through to have to be able to conceive and nurture those children and bring them into this world, and just realizing that, with multiple pregnancies that, oftentimes we're high risk because we're carrying multiple children at
Hmm.
one time. And so um, our the rate at which we heal and the time which our body may need to heal, it takes a while. And so even if we're told 6-12 weeks postpartum, you're healed, there's a lot of tissue remodeling that's going on for months and years to come. And so just giving yourself grace to know that it's not going to be a short fix, but keep at it.
Yeah, I think there was a time when I would have rolled my eyes at your answer just because,
Mhm.
I was there like, 2 months, I'm looking at friends, which is totally fine, like, bounce back, if you will, and that was, like, really hard for me. I had to, like, mute certain things on social media because, like, I didn't wanna see it. I'm like, "I still look like I'm pregnant." Um, and there is I think just now I'm getting to a spot when they're 2.5 years old where I'm like, "Oh, hey, body, like, thank you for what you did." Like, I'm better, now about it, but to your point, like, multiples often take longer to totally heal or come to some sort of healing, whatever that looks like for you. And it's hard, like, in the waiting for that. But I do think it will come, but you just kind of have to, like, work on it mentally too. But yeah, be definitely thankful for yourself and your body.
Absolutely. And I was kind of a little bit of the opposite of, my twins were born really early, and so I didn't get really huge. And so, I was going into the NICU every day. And because I was so stressed and not sleeping, like I was back down to my pre-pregnancy weight pretty quickly. And so on
Hmm.
the outside, everyone's like, wow, you look great. But I'm an athlete. I'm used to having muscle and being
Yeah.
strong. I looked physically great to people, but for me, I was like, this is not my strong body. And so again, having to kind of wrap my head around that, and appreciate, okay, you know, I do a lot to grow these amazing humans, and my priorities have shifted. But being able to kind of realize that people are approaching me through, they mean well, but kind of knowing what you need and learning what you need at that time, and giving your body space to be able to get there.
Yeah, and I didn't have NICU time. I made it to 38 weeks and 1 day. And so I did get that big, but I have friends and family who didn't make it like that long. And to your point, had NICU time, and all of them were like, I would much rather have gotten like huge stretch marks, whatever, to be able to carry them and not have to deal with the NICU, because that is a whole another animal of like hardness in there that I'm sure you could speak to. But then also it's so frustrating is not the right word, because like you said, people are well meaning, but I had people tell me I was like glowing and beautiful, and I carried very much and not in high, but like in front, so like from behind I didn't look pregnant, but I turn around and like have like two basketballs under my shirt type of thing. And so I got all these comments before, and I never really had like body image issues or anything, but then I deliver and I pretty much immediately lost all of the weight except for maybe like 10 pounds that I had gained, like pretty much like right after I delivered. But all my muscles and stuff are, everything, the uterus is coming down, like everything is just, I just delivered 15 pounds of baby. So it was really hard for me to like hear everything before giving birth, and then it was like radio silence afterwards. I'm like, okay. And even though I don't, to your point about like our bodies and how it may look like one thing, but like mentally and other things, it's just not. So I would say tread lightly on commenting on women's bodies around in general, period. But I think pregnancy is another time because you just said it, like even having people tell you looked good and everything, you were dealing with the NICU and just like recovering yourself. So yeah.
Yes, I agree. I try and, really just say to them, how are you feeling? Like, how are you really feeling?
Yeah.
Not just physically, but mentally. How are you?
Yeah.
Because what you see on the outside or on social media isn't necessarily the whole story.
100%. So this is obviously about women and that's what we're focusing on, but men have pelvic floors too. Do they need to be doing like pelvic floor exercises?
So men do have pelvic floors as well, so it's important for them to understand that this should be incorporated into their core work. And if they are doing squats or heavy lifting or things like that, that they can incorporate the same breath mechanics to be able to stabilize appropriately. And if they are having pain, whether it's penile pain or they feel like they're getting urinary tract infections all the time, those can be signs of pelvic floor dysfunction. It's important that they talk to their medical provider about that.
And do they fall under the same ruling that really we should not be sitting on the toilet for more than 5 minutes when we're trying to poop?
Yes. Yes, same thing is that you have an urge to go, you go to the bathroom, you sit, you go, and then if you need time to read by yourself, you can read by yourself outside of the bathroom. You don't need
Yeah,
to sit on the toilet to be able to scroll on your phone or read for 10 minutes.
yeah. And so I just wanted to say this because I do not have this problem with Nick, but I know a lot of people do, to where their husband will just go to the bathroom, I don't know, 5, 10 times a day and be in there for a long time because they're pooping. So this is your permission to say, like, babe, I'm worried about your health and your pelvic floor health, and your pelvic floor matters too, and you really shouldn't be sitting on the toilet for more than 5 minutes at a time. So
Yes.
this is your,
If you urgently have to go to the bathroom every time we're getting ready to bathe the children, and then you're in there for 30 minutes, something's not
yeah.
right. So
Yeah.
let's have you go see a pelvic floor
Yeah.
physical therapist, and they'll assess your pelvic floor muscles and make sure everything's working properly.
Yeah. A side question just for everybody. But how long is too long to hold your pee? Because that affects your pelvic floor too. Is it we should just be going every time we have the urge within reason? Because I know some people have like the urgency to go when really they should be holding. So is there a balance? Sorry, let me ask that a better question. What is the balance between not going as soon as you have to go, because I know people have urgency, and not holding it for hours upon end? Like, when should we go
Yeah,
and pee?
Yeah, I think it really depends, because it depends on the volume of fluid that you're
Mm.
taking in. And so there's some people that, especially as we head into the summer months, they're drinking upwards of a gallon a day, or are people that are breastfeeding and they're drinking a lot more. So they're challenging their system a lot more. And so they may be going to the bathroom every 1 to 2 hours, but they're going a full bladder's worth because they're challenging their system so much. And then you have other people who are going every 1 to 2 hours, but they're drinking a third of what these other people are doing. And they say, I feel like I have to go and I have to go right now. And I go and only a little bit comes out. So their severity of urge doesn't match the volume that's coming out. And then you have, our wonderful medical professionals and teachers who are like, ooh, I can hold my bladder for 12 hours and I have the best bladder ever, which is not ideal either, because we don't want to overfill our bladder constantly, because then over time it can struggle to be able to completely empty. So really, it's vague, but it really depends. But hopefully that gives you a few different
Yeah.
perspectives.
Yeah, that was great. Thank you so much. I think that's really it. Do you have any other things you want to add? It's okay if the answer is no. I think that was all my questions.
No, I think it's great to have people speaking up about this and just kind of opening the doors and saying, hey, let's talk about this. Like, this is our anatomy and we should learn more. And kind of, my twins are a little bit older than yours, and we're going through our hormones are changing, and I have girl twins, and so they just had the talk at school, and we've already had a little pre-menstruation celebration in our house. And so one of my daughters said, hey mom, can I take your uterus stuffed animal? Because of course, when your mom's a pelvic floor physical therapist, you have uterus stuffies. And so she proudly took it into class. So the more we can talk about all of these things that, menstruation, this is a total side area, but like, that's our body's healthy. Like, that's healthy when our body menstruates. And so just being able to speak up and give your friends, family, the space to be able to openly talk about what they're experiencing.
I love that. I love that. That's so, I don't know if cute's the right word, but I'm going to say cute. I love that of just bringing the awareness. And I can't believe she asked that. That's darling. And very
Yes.
very pro that. Well, thank you so much for speaking with us. Is there a way to contact? Do you want to give your email, or you just want me to talk about Origin, or what do you want me to say? Usually
Yeah,
I say
you
if they
can.
want to contact you.
Yeah, people can contact me. I'm Andrea.Levkowitz at theoriginway.com. Or you can go to our website. It has tons of information there where you can be able to schedule online with a physical location close to you or with us virtually. So whatever your preference is.
Yeah, well, I'll put those in the show notes so you can easily email her or just look at the Origin website because it's wonderful. But thank you so much for being on with us today, Dr. Andrea. I really enjoyed it, and I think everyone will too. You're so knowledgeable, and I'm so thankful that you are in this field and educating.
Thank you for having me.
Yeah, thank you.
Boy, girl, mom, and dad. Gotta wash those butts together. It's a trip, but we'll guide you through with tips and tricks for boys and girls too.